my first question to Dr. Alianza is, what's the difference between the eye doctor and the eye specialist? More particularly, the optometrist and the ophthalmologist. And the neuro-ophthalmologist, what's the difference?
Yeah, good question. Good questions. There's a lot of different titles, and sometimes I think they merge, and sometimes, it's a little bit, and shows a little bit of ambiguity in what the roles are. But to be frank, every member within the eye care community is vital. And there's a title that you didn't mention that I do want to highlight it as well. But I would say, there's the optician, there's the optometrist, and then there's the ophthalmologist. And so with the optician, they are experts when it comes to crafting and creating and refining the perfect pair of lenses for your glasses. And so their handiwork, their craftsmanship will allow you to resolve your nearsightedness. It would help, resolve your astigmatism or your farsightedness. There's times when, where you've celebrated a good amount of birthdays and that ability to read up close is gone. It's called presbyopia. And they could help, create the perfect glasses to help resolve some of that. And still allow you to see at a distance with a great pair of progressive glasses. And so those are the opticians, and then with the optometrists, they have specialized training in identifying and diagnosing eye diseases. So you can go to an optometrist and they'll let you know if you have a worsening cataract. They'll let you know if you have macular degeneration. They can identify glaucoma. They can identify, stroke on specialized testing. And so the optometrist training is very unique in that, they do additional years after undergrad, just focusing on eye pathology. They focus on optics. They are experts when it comes to creating a personalized prescription for you for your glasses to improve your vision, or personalized prescription for your contact lasers. But generally speaking, I would say optometrists, they focus mainly on identifying and diagnosing disease, and there's some treatments that they can initiate in terms of topical drops. And with the ophthalmologist, so we do a little bit of extra training in the realm of intervening in a surgical manner. So most ophthalmologists will do cataract surgery, will do retina surgery, glaucoma surgery. There's surgeries that we will do in terms of, if there's an individual with a lazy eye, we could help realign the eye movements. And so that's strabismus surgery. And so within ophthalmology, there's a general ophthalmologist, which is a comprehensive ophthalmologist, and they deal with a breadth of different pathology. And then we have subspecialties within ophthalmology. So my particular subspecialty is glaucoma, but then there's also neuro-ophthalmology, there's uveitis subspecialists, there's retina subspecialists, oculoplastics. And so we all collectively, the optician, the optometrist, and the ophthalmologist, we all work together to provide, of excellence.